When I see new patients, one of the issues that's brought up is their previous concern with not being able to see a physician within a reasonable time. That's a real problem out there. And the way that I like to address things is in our office, we will see patients either same day or next day. This is done with the help of myself, a staff that helps to expedite appointments, prioritize patients' needs, and a nurse practitioner who's very well qualified to help with seeing patients rapidly along with me. The seriousness of the problem needs to be evaluated, and that's best evaluated immediately by phone, secondarily in person, and during that process, if a specialist is needed, depending on the seriousness of this, I will have the physician called by myself in the presence of the patient. If that's not possible, I'll set up a time later in the day to speak to the patient and let them know the follow-up that we've helped to arrange. There are two types of emergencies. Emergencies that require immediate medical needs, and those which I call emotional emergencies. New diagnoses of bad illnesses that don't necessarily need to be treated immediately, but a patient needs to know that a plan has been put in action. We take the same priority with specialty referrals as we do with our visits. The specialist will not likely be able to see someone same day if they call up, but if I call up a specialist with an immediate concern of a patient, they're likely to be seen within a very reasonable time, depending on the seriousness. When I have patients that come in with cardiac issues that don't require hospitalization, I can sometimes get them in to see the specialist same day or next day as well. These things are important, and with time, these symptoms can change so that a non-urgent referral may turn into something urgent. And when a patient has an appointment already scheduled with that specialist, it becomes a whole lot easier to get them in sooner if they've already made the appointment. We give the patient the responsibility to help in this process by taking our notes and diagnostic tests with them, as well as us faxing or emailing it to the specialist. Because when the patient arrives to the specialist's office, we want to make sure everything is there already so that the specialist has an easier time understanding the entire medical process. That gives a patient a better visit and a better outcome, and then they follow up with us to carry on with their care.